Good afternoon and welcome to UnitedTV. My name is Kemal Erkan. This is our wellness webinar. It's the first event of 2024. I have our program director, Dr. Hundal, with me, and also one of our managers in the program, Caroline Weber, and also our director of clinical integration, Donna Gunkel, with me. How are you guys doing?
Excellent. Thank you. And Happy New Year.
Happy New Year. So we'll continue to provide these education sessions for our patients who are dealing with diabetes and how to control diabetes and what would be the best course of action in different cases and how diabetes is managed in different situations. Outside of your doctor's appointment, this would be another support for those patients who are struggling with diabetes. So again, when it's the clinical presentation, our number one criteria is to have the expert in the field. So either this is one of the providers, but when it's one of our physicians, then it makes it more reliable from the clinical standpoint. So any patients who do go to Dr. Hundal on a regular basis or his practice can benefit from these as an additional support from our side. Hopefully we can be helpful for those patients. Now we are going to have our regular presentation, but I would like our presenters to introduce themselves, and then we'll start PowerPoint.
Hi, I'm Dr. Hundal, one of the endocrinologists in Newark area. I've been practicing here for almost like more than 22, 23 years. So we're active part of the diabetes community, and other than diabetes, I do general endocrinology, and very fortunate to be part of the United Medical program. Here we have excellent dietitian, because as an endocrinologist, I need good help from the nutrition department, and we have excellent people helping our patients on a daily basis. So I'm really thankful to them for the continued support and help for all these years.
Hello, and Happy New Year. My name is Donna Gunkel. I am the Director of Clinical Integration for United Medical ACO. And one of the things that I do is oversee our diabetes program, which is the only physician-led accredited program here in Delaware. We do have 5 dietitians on staff at this time, which help to serve our entire United Medical population. And Caroline helps to oversee our diabetes program.
And I'm Caroline Weber. I'm just one of the dietitians who helps to manage the program, as Donna said. So I'm one of 5. So I work with one-on-one counseling with patients, but also kind of facilitating and going through. So we do a diabetes support group and then our diabetes wellness webinar as well.
All right. Well, thank you so much. So I'm going to start with the PowerPoint. And so Dr. Hundal, I'll make sure that you don't have to say too many next slides. So just so that everyone knows, in our program, we do have 2 social workers who works with us directly, Erkan Portland and Arna Williams. So they also support our patients as they may need help from the social worker standpoint. So, all right, today we are going to talk about New Year resolutions. And Dr. Hundal, we are with you.
Right. Just one second. My screen is some of the.
Is it coming a little bit slower on your side?
No, it's like very small screen on the side. I may have pushed some wrong button here. Standard. Okay, so this is the first slide. All right, so again, Happy New Year to everyone. So this is with every year, I'm pretty sure every one of us, I'm not talking about just individuals with diabetes, everyone of us, we try to look into our life, try to see how we can do differently in the new year, how we can improve our lifestyle, overall health, and be a better individual for the coming year. So again, I try to think about things which are very, very important. Top of them is happiness. So again, if you're happy, no matter whether you have money or not money, or what you have a house or not, I mean, happiness is the key. In general, from scientific point of view, if you're more relaxed, happy, all your hormones, stress hormones, they are down, blood pressure is down, overall mood is better. So it's all over. Just like your health really gets like a boost from that bout of happiness. So that is very, very important key element that you should work on. So if you're happy, the second, health is very important. So again, by focusing on your priorities in the life, okay, how can I do better in terms of my health? Because health is wealth. That's very, very important. If you may be a millionaire, but you don't have good health, you can't enjoy all the foods, all the drinks, all good companies, then that wealth is meaningless. So again, health is very important. I wrote wealth over there. Yes, it's important because now, as you know, the cost of the drugs are very expensive. As with the insurance changes more and more, the burden of all these medications, the cost of the medication is put on the patients. So again, we have to prioritize our things in life and look at how I can save money for my future. As I'm growing older, I will need more medications, blood pressure, cholesterol. Should I have sufficient money in my pocket to pay for these deductibles and other costly medications? So that is also very, very important part of the overall plan. Always set up realistic goal. That is very important from every point of view. In your day-to-day lifestyle, if you say, okay, I'm going to exercise for 2 hours a day, that is never going to happen. If you say, oh, I'm going to lose like suddenly 100 pounds, that is never going to happen. Then you get frustrated. So it's very, very important to set up a realistic goal which you can achieve and be more happy about it, be more satisfied about it. Then you will be less likely to fail. So you can talk to your physician, and in terms of your blood pressure, cholesterol, other things in your life, you can check with your financial advisor, okay, how I can make things better from finances point of view, but always set up some goals in your life. Then the last thing is also, a lot of times we compare ourselves to other people. We look at all these ads. They show you all these young girls. They have it's walking around like they lost like this much weight. They are looking so slim. And we look at ourselves and then suddenly they say, oh, I mean, you just feel depressed about it. Everyone is different. So you should not compare your life, your health with anyone else. You are the only one person in this world. Nobody's like you. So look into yourself and say, okay, how I can do better as compared to 6 months ago, 1 year ago. My weight was this a year ago. How I can bring it down. Don't look at your neighbor or look at someone else and say, oh, their weight is 130 pounds, mine is 230 pounds. No, don't compare yourself. It will just add to your frustration, depression. Just compare yourself with yourself and start from there. So as I mentioned, health. One of the key elements for maintaining good health is exercise. That is a must. Without it, I mean, with time, every one of us, as we age, our metabolic rate is going down and down. No matter what you do, our metabolism is slowing down. So to boost up our metabolism, it's very important to keep up with the regular activity. So in general, the recommendation is that we should do some moderate intensity exercise, at least 150 minutes a week. So 30 minutes, 5 days in a week. Always start slowly. If you haven't been exercising, don't suddenly start lifting 100 pounds weight. You will end up injuring something and you won't be able to do any exercise thereafter. So always start slowly and then increase the intensity, pace of your exercise. as your body can tolerate. Sometimes, especially in older individuals, middle-aged person, always consult your physician before starting any vigorous strenuous activity. Sometimes you may have to have some cardiac evaluation if there was previous history. Some people have undiagnosed cardiac problems, heart problems. Suddenly you start running on a treadmill, it's like a stress test, and people can end up with some cardiac event, even heart attack. So again, it's important to have yourself evaluated if you are starting a new exercise program. In general, from blood sugar point of view, important to understand that both type of aerobic and resistance training, they are the best way to lower the blood sugars. So combination of these two exercises are the best. So you can one day do some running, other day do some resistance training, weightlifting. So just mix and match, then you will get the best benefit. In day-to-day basis, one of the important thing to remember is to avoid prolonged sitting. So again, we sit in our offices, we sit at some place, we are sitting for too long. Nowadays, especially if you have these watches, they also give you from time to time reminders, okay, time to get up. So listen to them. This is important. If you need to get up a little bit, walk around, stretch your legs, and then get back to your work. So these are very simple, important things. Day to day, when you're going out for shopping, park your car farther away. Don't fight with other people trying to get the nearest parking lot. You can go further away, park your car a little bit away, just still in a safe place, so that to get some extra walking to go to the store or the mall. So again, every day, if you can, if your knees are good, take the stairs. Don't take the elevator. So every day you have to make a difference, increase your metabolic activity, and you will get much better benefit in terms of weight loss. During exercise, important to keep yourself well hydrated. So even before you start exercise and during the exercise, depending upon how much you sweat, please make sure you drink plenty amount of water. There are diabetic medications that needs proper hydrations. So you cannot afford to get dehydrated and then end up with some other problems. Also, there are some medication like insulin and sulfonylureas. These are the patients with diabetes who are on these medications. When you start exercising, suddenly your muscles become much more sensitive to the effect of insulin, and you can have very severe low blood sugar reaction if you're not being careful. So when starting the exercise program, make sure you cut back on the talk to your physician and maybe reduce the dose of these medication. Keep a watch on your blood sugars more often during the exercise initially, so you know how your body is reacting, and then you can adjust the medication accordingly. Sometimes the bout of exercise, the effect on blood sugar can linger on for 16, 15, 18 hours. So even if your blood sugar was fine by the end of your exercise, it can drop low in the middle of the night. So you may have to adjust your medication or maybe slight snack before going to bed. So always keep a good eye on your blood sugars when you're starting a new exercise program. Nowadays, we have the continuous glucose sensors. They are very helpful. If they are covered by your insurance, you can use them, and that gives you a fairly good idea how your body is responding. Your blood sugars are responding in terms of like with exercise. Some people who have very brittle diabetes, good idea to keep glucagon injection kit. This is for severe low blood sugar reaction where the person cannot eat by mouth, then the family members have to give the injection. But in general, keep glucose tablets, keep glucose drinks, like these all these drinks like Gatorade, any other sport drinks. If you tend to drop your blood sugars more often with activity, then in between drink those drinks rather than plain water. That will avoid low blood sugar reaction. Now, individuals with diabetes and even other overweight or obese individuals, the key is weight loss. Yes, you're doing exercise, but if you don't lose much weight, then you may not get the best benefit. But still, exercise is still the key that you have to, even if you are overweight, weight is not going down, but still, I won't stop exercising. Keep doing exercise. That's important. Now, in terms of weight loss, again, as I mentioned in the first slide, set up a realistic goal. Don't go try to overachieve and say, oh yeah, my friend lost 100 pounds. This is what I'm going to do. No, look at your own body, see what you can realize, what you can do, how much time you have for exercise and other activities. So don't go by what others are doing, go by what you can achieve. Then you will achieve satisfaction in your life and will then make more efforts. And then you can even go down, your weight can even go down. So roughly, this is just a rough idea how to plan. So typically we say, try to lose 10% of your body weight over the next 6 months period. So I've given an example over here. You have like 240-pound person. So if we do 10% of that, that'll be 24 pounds over the next 6 months. If we go by monthly basis, 4 pounds per month or 1 pound per week. So if you set up a goal like that, okay, and this is what I'm going to do. Let me try 1 pound per week. This week you could achieve 1 pound weight loss. Next week, you had to go to a couple of parties, ate too much, you gained 2 pounds or 3 pounds. The next week, following week, try harder. Try to take care of that 2-3 pounds extra which you gain. So in that way, every week you have to make efforts to slowly try to bring your weight down by 1 pound. And over 6 months, slow and steadily, you will be surprised that you can achieve this type of goal. So again, consistency is the key. So don't think that, okay, one day I can do exercise, then next 4 days I'm going to just sit, relax and eat all my snacks. That's not going to do it. Every day calories are going in. Every day calories are supposed to be burnt. So if there is a negative calorie balance, then only you will be able to lose weight. Very, very important. I have highlighted over there. Actually, can you go back? Yes. Need to see the dietitian. If you haven't seen any, please make an appointment. Sometimes we as individual, we do not understand all these things about calories, how to read the food label. We think we are eating less calories. That may not be the case. So it's very important to talk to them so they can teach you better. Then you have a better idea how much calories you're consuming every day. And you will be surprised, actually, you are eating much more than you thought. Watch your mouth. Mouth, I mean, again, in terms of words, in terms of eating, can make a big difference. If you eat less, there is no way that you won't lose weight. We keep on eating all the time. We don't pay attention. Even while eating salads, put like thousands of things on the salad. We are thinking, oh, we're eating healthy food, but all those calories, all those the salad dressing, some of them are loaded with fat, with the calories. We ultimately end up with eating so much, then you say, okay, why I'm not losing weight? So again, we have to, in general, portion control is the key, along with regular exercise. These are the two things these are very, very important. And once you talk to the dietitian, they will give you even more information. Next one. So what's the benefit if you lose weight? There are plenty of them. I've highlighted a few of them. So the most important is you feel good. That's the most important one. If your mood is good, you feel happy all the time, that's the key. In terms of diabetes, if you lose weight, 5 to 10% of the body weight, you will need less diabetes medication. Blood pressure and cholesterol levels go down. Sleep apnea, that is a very common condition which happens in obese individuals or even in overweight individuals. So if we lose weight, sleep apnea gets better. And when sleep apnea gets better, indirectly it helps with a lot of other things. You feel less tired, blood pressure goes down, less stress on the heart. So it's all good, like when you lose weight. We reduce our risk of heart disease and stroke as weight goes down. Carrying less weight helps your knees, arthritis, joint pains, they get better. Mood overall improves, like less risk for depression and anxiety. Those symptoms gets better. Self-confidence improves. And in some individuals where it's the sleep apnea is connected with the erectile dysfunction, if somebody loses substantial amount of weight, that does help with improving the testosterone levels. So the erectile dysfunction also improves in those individuals. Next one. Now, if you have diabetes, then New Year resolution should be how I can manage my blood sugars in a better way so I can prevent long-term complications. So look at your labs, talk to your physician, and these are the goals that you should set up, that I want to bring my A1C less than 7%. The lower is better, but without causing any low blood sugars. Low blood sugars are not good. So again, next time when you see your physician or you do not have access to your labs, try to get them and look at your last A1C and work hard. Talk to your provider and say how I can lower my A1C less than 7. When you're checking your blood sugars at home, usually target blood sugar should be 80 to 130s range before meals. 1 to 2 hours after meal should be less than 180. So if you're not checking your blood sugars, please start checking blood sugars at different times of the day and try to target these blood sugars. If they're running high, talk to your provider and say how it can do a better job. If you're wearing a glucose sensor, then this is called time in target. That should be 70% of the readings should be between 70 to 180s range, more than 70%. Below 70, that is considered low blood sugar, should be less than 4%. And severe low blood sugar is below 54. Only 1% of the reading should be a target goal. So look at your glucose sensor and see how far are you from these target goals. And again, last important thing, avoid low blood sugar. That is not good for the heart. People can die from low blood sugar reactions, like in the middle of their sleep. So please, if you're having low blood sugar symptoms like heart racing, sweating, anxiety, feeling hungry, feeling dizzy, check your blood sugar, talk to your provider, and avoid this problem. Next one. Blood pressure is very important, part of the treatment plan for diabetes. Monitor your blood pressure at home, do regular exercise. Weight loss has nicely been shown to reduce the blood pressure, reducing the salt in your diet. And very, very important thing is good night's sleep. Sleep at least 6 to 8 hours daily. These are very, very important. If somebody has sleep apnea, please have it corrected, because untreated sleep apnea will also raise your blood pressure, blood sugars. So that's very important. Take your medication regularly. If you're missing your medication, your blood pressure run high blood pressure, very high risk factor for stroke and heart attack. In general, blood pressure should be maintained with less than 130s by 80. 130 is the top number and 80 is the lower numbers, diastolic. As long as you're not feeling dizzy, you should try to keep blood pressure below this target goal. So work with your provider and keep your blood pressure in a good range.
So, Dr. Hundal, just one thing that I wanted to elaborate on the sleep side. Many people, they may not know how simple it is to get this sleep study done. The home sleep study is the easiest way to get it, and then their primary care can order it. So that's an overnight study.
Right.
And based on that, they can, once they find out if they have the sleep apnea based on the AHI score, then their primary care would most likely send them to a sleep specialist. But that's one of the really important ones for them to know whether or not they have sleep apnea.
Yeah, definitely. This point should not be ignored. That's why I said earlier also they need to look into their sleep apnea. It's connected to so many different other diseases. Then looking at the cholesterol levels. So look at your cholesterol panel. Usually they give you good cholesterol, bad cholesterol, triglycerides, total cholesterol. So it's very important in order to reduce the risk for heart disease, our cholesterol levels should be at target goal. So in general, lifestyle modification like weight loss, exercise, reducing the saturated fats, like this, eating more of like it's butter, fried foods, then the egg yolks, other high cholesterol meat products, that can, if you reduce the amount of those products, then that can help to reduce the bad cholesterol. Eating more fish, increasing more omega-3 fatty acids, that has been shown to be protective in terms of reducing the risk of heart disease and reducing the bad cholesterol levels. Then doing more exercise, weight loss helps to improve the good cholesterol, which is the HDL cholesterol. So any person with history of diabetes aged 40 to 75 years, they should be placed on moderate intensity statins. So statins are the most commonly used drugs to lower the bad cholesterol. So because there's such a high prevalence of heart disease and stroke in individuals with diabetes, the American Diabetes Association has recommended that they should be on these cholesterol medication. For a person younger than like between 20 to 39 years of age with diabetes, they can be on these medications if they have additional risk factors for heart disease, cardiovascular disease. They can be placed. But otherwise, most of the time, especially in females, they are in reproductive age, trying to get pregnant. So during that age group, we try not to put them on statins, which are not safe during pregnancy. In general, our goal is to keep the bad cholesterol below 70. And if somebody has heart disease or stroke, then the bad cholesterol should be below 55. Next one. Aspirin therapy, that's very important. A lot of times we ignore it. So anybody with history of diabetes and heart disease should be on aspirin. But if someone has history of diabetes and no history of heart disease, then the role is not clear because there is a risk for bleeding also in the stomach bleeding. So in those individuals, you can use in some individuals if they are at high risk for heart disease based on other risk factors, strong family history. But in general, it's not recommended that everyone should be on aspirin therapy. So please talk to your provider. And if you meet the criteria for aspirin therapy, you should be on these medications to prevent any heart attack or stroke down the line. Next one. Proper follow-ups are very important. So if you haven't been to your provider in a long time, you have diabetes, please make appointment. Annual eye examination is important. Sometimes if you're not going to an eye doctor, you can have silent bleeding at the back of the eye, especially if you have uncontrolled diabetes. You may wake up suddenly blind in one eye because of that bleeding at the back of the eye. So please go for regular eye examination. And then how often you need to be seen will depend upon how much damage has happened at the back of the eye. Then your eye doctor can determine how often you will be seeing them. Examine your feet every day. That's very, very important. You should see a podiatrist, foot doctor if you are having problems. Your provider can determine that and tell you. Foot ulcers, they are very important, like complications of diabetes, which can be prevented by good examination of the feet on a daily basis and then through your podiatrist or family care physician. Urine testing is very important because this tells you early signs of kidney damage related to diabetes. So annually, your urine test should be checked for albumin-creatinine ratio. So talk to your physician. If it hasn't been done, remind them that, okay, I need to check my urine test on a yearly basis. Next one. Smoking. I can't say more for that. I mean, smoking, it's just bad all over. Other than, in general, if I talk only for patients with diabetes, smoking will increase the risk for heart disease, stroke, poor circulation in the legs, can lead to more bone loss, can lead to more kidney damage. And in general, in patients who smoke and who have not developed diabetes yet, smoking puts them at high risk of developing diabetes. And if you quit smoking, you may reduce your risk of developing diabetes. So please work with your family care physician, and there are a lot of other helplines available that can help you try to quit smoking. Even secondhand smoking is bad. So again, think about your relatives, people in your family. You're smoking yourself, you're putting your kids, your spouses at risk as well. So please don't ignore this. Next slide. So mental health is very important. Patients with diabetes are more prone to have more anxiety and depression. So please don't feel shy that you don't want to talk to a provider about these things, this indirectly does affect your blood pressure, overall your mood. Then people get more depressed. They're not taking their medication regularly. They don't think healthy way, maybe eating the wrong food. So please, if you're having those symptoms, discuss with your family care physician so they can take appropriate action and can refer you to a counseling or psychiatrist for more advanced care. But again, you have to take care of mental health, which is a very important part of the treatment for diabetes. Now, just let's say this is, I put this just slide over here. This is very, very important and new. Anyone with history of type 1 diabetes, you should ask your siblings, parents, kids, first-degree relatives to get tested for antibodies and A1C. These are antibodies, insulin antibodies. Reason being, now we have a drug, this is called TZL, which can prevent or delay the onset of type 1 diabetes. So if the antibodies are positive and person has pre-diabetes, A1C is yet not in a diabetic range. So this person has not developed full-blown type 1 diabetes, which is a type of diabetes where pancreas does not make sufficient insulin. Then these type of individuals can be treated with this medication. It's like a 2-week infusion of the medication that can prevent the onset of diabetes. And just imagine, like, it's, you don't have to check your blood sugars, you don't have to like inject insulin all the time. So again, this is a new drug on the market. So please educate all your relatives that they should talk to your providers and get screened for these antibodies. Next one. And for individuals with type 2 diabetes, these are for history of, like, for example, your parents have diabetes, you yourself have not developed diabetes, or person has pre-diabetes, then how to prevent development of type 2 diabetes is through intensive lifestyle modification. Have a good weight loss reduction, or at least 7% of your weight if you lose your initial body weight. That has been shown nicely to lower your blood sugars. Eat healthy food. If the insurance covers, then please go and see a dietitian as well. They can give you a lot of good points, how to reduce the calorie intake, how to eat healthy food, and be consistent in your efforts. Regular exercise, regular like calorie reduction is important. And also metformin, one of the drug which is used for diabetes, can also be used in individuals with pre-diabetes aged 25 to 59 years of age and whose body mass index is more than 35. So they can benefit from use of metformin as well to decrease the risk of developing type 2 diabetes down the line. Next one.
All right, I believe this is the last slide from Dr. Hundal's side. Dr. Hundal, thank you. Thank you so much.
Thank you.
So the only thing that I wanted to kind of reemphasize, you already mentioned this, but regardless of whether or not we have diabetes, just like those who don't have diabetes, we go through the same type of issues, or we take the certain steps to actually prevent diabetes, but the prevention, just not become diabetic, versus if you are with diabetes, what we have to do to kind of control that or prevent that are pretty similar in terms of keep a good log of what you eat, when you eat, how you eat, and keep all the phones these days, the smartphones, they are actually they are a really good way to kind of keep reminding ourselves, okay, we are sitting too long, or this is how many steps we have this week or today. Those statistics do really help. I personally use it, and as I take it more seriously in the last several months, the results are coming. It's still a little bit slow, but it's coming. And then once you start actually feeling it, it may be 3-4 months from the time that you start recording these or start paying attention. So I think that would be important for our patients to know that it's really simple, or like everyone else really have to do even if they don't have diabetes, to kind of keep themselves healthy. Caroline, I know you are going to start your side with this smart way of setting goals from the nutritionist standpoint. Are you able to share your screen, or do you want me to continue?
I can share my screen.
All right.
All right. So as Dr. Hundal had said in the beginning, setting realistic goals is pretty important. Just with any kind of goal setting, whether you have diabetes or not, we want to make sure we're being specific, that we're making goals that are realistic. So today we're going to talk about some techniques we use in counseling to kind of form goals for the greatest chance of success. So SMART goals. So we talk a lot in counseling about SMART goals. It's an acronym we use to describe the type of goal setting where it's specific, measurable, attainable, relevant, and time-bound. So going through each of these areas will help us create a goal that is not only going to be more attainable, but it's going to be sustainable. We're going to be able to do it long-term rather than if you've ever started a goal, it's been really lofty, you end it, you feel guilty, you feel sad. We don't want that. We want you to feel confidence in the goal setting that you have. So we'll go through kind of what SMART goals mean, a couple examples too, to help set off some goal setting for the new year. So the first one is specific. We want to be really specific and clearly identify the goal. Answering the questions, who, what, where, when, and how are going to be integral to setting the goal that you want to work on this year, this week, this coming day, right? Goal specificity increases the ability for us to focus and helps create that action plan for goal achievement. We talk a lot in therapy and counseling on the trans theoretical model, or what we call the stages of change model, where we each go through, there's 6 different stages: pre-contemplation, which is you're kind of thinking about doing something, but you don't really have any plans yet. Contemplation, which is you're thinking about it, you're most likely going to pursue it. The action stage, where you're fully in and committed and doing the actual thing you said you were going to do. The maintenance phase, which you're kind of in that, or I skipped the preparation stage. Before action stage, there's preparation where you're preparing to do it. Then you get into action. Then you get into maintenance where you're doing the goal, you're succeeding at it, you're just kind of continuing it. And then finally, you're at termination. If you've reached that goal, you want to discontinue it, you absolutely can. So it's important when we're thinking of a goal that we're in that preparation and action stage so that we have the best ability to achieve the goal. If we're kind of contemplating it and creating a goal, it's not really going to go anywhere because we haven't put the effort into planning it and to having the actual techniques and skills to pursuing it. So we want to be specific. So if we're thinking, for example, I want to be healthier. I want to eat healthier in the new year, right? That's a very broad goal. So what does that mean? What does eating healthier mean to you? So we want to kind of dissect that a little bit. Does it mean we're going to have more fiber? Does it mean we're going to work on our portion sizing? For an example today, we'll say, I want to eat more vegetables in the new year, right? That's very specific. We want to focus on one specific thing and make that big goal less broad so that we have a better chance of achieving it. So the next one is measurable. We want to define the goal in measurable terms, and setting that measurement helps us with motivation and clear direction. It helps kind of fuel the process of reaching those aspirations. It keeps track of the progress, incentives to keep going. So when we're thinking about that, vegetable example, how can we make that measurable? How many times a day do we want to eat vegetables? How many servings a day do we want to eat? Once we kind of set that measure, we have a more clear direction of the way we're going to achieve that goal. Then we have attainable. We want to make sure our goals are realistic, like Dr. Hundal said. If your goals are unrealistic in terms of time commitment, skill level, right? If you're not a runner and you say, I'm going to run 2 miles a day, that's probably not attainable, and it's probably not going to last very long. It's probably going to hurt. So it makes the goal more difficult to achieve. So we want to start smaller. Smaller is always better. And especially if you've never done it before or you're not used to it, it's not part of your daily routine. Starting smaller is going to increase your chances of success. It's also going to build confidence. Once you achieve that goal, right, we can build upon it, make it even more lofty. You could increase the time frame, you could increase the amount you're doing it over time, which gives you better success rate as well. So if we go back to that vegetable example, if you don't like eating vegetables, saying you're going to eat vegetables every meal for every day of the week is probably not attainable in that instance. But say we start off small. We could do 1 serving of vegetables 1 to 2 times a week. That might be a more manageable start. And then if you like it, you can keep increasing it. And usually that results in a better success rate as well. Then we have relevant. So this one's actually very important because we want to make sure the goal is important to you personally, right? If someone just recommended something to you saying, you know, running is the best exercise, right? But you actually don't like running, and running is not that important to you, and running doesn't cause you any sort of sense of joy, right? We're not likely to do that long term. Having a goal that you will enjoy or having a goal that is important to you is going to be necessary for achievement because it means it's going to be long term. It's going to be sustainable over time. So, for example, if we're talking about our vegetables, right? Why? Ask yourself, why am I pursuing this goal? Is it because someone told me to eat more vegetables because it was good for me? Or is there a specific reason? Like we want to lower our cholesterol. Maybe there's more fiber in vegetables and that's going to help our blood sugar. Having that specificity in why it's relevant to you is going to really help form your goal, but it's also going to keep that encouragement going as you progress through your goal setting. And then finally, there's time bound. We want to make a specific time frame that you're going to achieve the goal. This not only tracks the progress, but keeps that urgency going. If you're just saying, I'm going to eat more vegetables for every day of the week, but you don't have a time set, there's not really going to be any urgency or any incentive to kind of keep going. It helps you keep accountable where you can kind of check the boxes of like, okay, I've done this through the week, however many times I said I was going to set it. So if we go to our vegetable example again, we can say in the new year, we hope to increase our vegetable intake 1 serving a day for at least 1 to 2 days per week at dinner time. So maybe dinner time is the easiest place for you to find vegetables in your, day. So having that specific time frame, you can achieve that. And then once you feel, okay, I've got that down, you could add it to lunchtime. We can slowly work on increasing or changing the time frame. You can always change the specificity or the time frames or any part of these goals as you move forward, but we want to start slow and steady. So these are just some more examples of some SMART goals, like making time for self-care. That's a pretty broad goal. Like I want to make time for self-care. So how do we break it down and make it more specific? So I will schedule 30 minutes every day for self-care activities such as reading, going for a walk, or meditation. Now, you could change things up a little bit every day, might be a lofty goal if you don't really have the time in your schedule. But this in itself would be considered a specific goal that has measurable 30 minutes a day. It's attainable, requires a smaller time commitment. It's not like 2 hours a day where you say, I'm going to meditate for 2 hours a day or walk for 2 hours a day. Relevant self-care is important, right? It's going to make you feel better in the long run. It might be very important to you. And it's time-based. The goal is ongoing. It can be pursued for an indefinite period of time, but you can also change it. You could say for 3 weeks, I'm going to really focus on my self-care. And then if it goes well for the 3 weeks, you can kind of increase that time frame as well. Then our other example is around exercise. So a lot of us start the new year saying, I'm going to exercise more, I'm going to move more. But really, I think getting more specific with these exercise goals is what kind of leads us into sustainability. So over the next 6 months, I will go to the gym or walk outside for at least 30 minutes. We want to make a specific statement about what we're going to do and how long we're going to do it. We want to measure or track the amount of times that we're going to walk, right? Because that's going to keep us accountable. And then we want to make it measurable and attainable, relevant. The exercise, it has many benefits, mental, physically as well. And then time-based. So we want to say 2 to 3 times per week for 6 months. You could increase that, of course. But we want to start in that small, manageable area where we have the best rate of success. So as we kind of enter the new year, you hear a lot about resolutions. I don't love the word resolution just because sometimes we get caught up in the fact that we make these lofty resolutions or things we want to change, but we have no way of getting there. So a resolution is actually a type of goal. It means the act of determining. We're determined we're going to do something. The goals are what help us follow through on sticking to that resolution. So when we combine the two together, we can create a resolution, but we want to strategize how we're going to get there. So SMART goals are just the way we do that, and it lines up with our mission, our vision for change. And most people who set that intentionality in the goals are more likely to achieve goals. And we do a lot of this, even in nutrition counseling, when it's focused on food-specific things, blood sugar goals, things like that. So starts planning really SMART goals, and we usually have a better chance of achieving them in the long run. And that is it for my slides.
Okay, thank you so much. So, Dr. Hundal, did you want to add anything?
No, I think she very well stated the important facts. Set up the goals, realistic goals.
My watch just told me it's time to stand up and move. I guess we've been sitting too long.
Yeah, just, I mean, day-to-day lifestyle is important. I mean, you can't win this race in a day. Have to be consistent. That's the key.
Yeah, absolutely. So we'll be back with more discussions and topics around diabetes. And this was our first session of the year. We have our support group for our patients. That's a private event through Zoom. For those who may be watching this, and then if you are United Medical ACO patients, you can reach out to us and we will be able to share those links. I do want to thank all of you joining me today, and then we'll be back in the next couple of weeks with diabetes. Thank you so much. Bye-bye.
Thank you.